It seems everyone has at least some anxiety. It's part of living in modern times. Our attention spans are constantly being pitched at, and most of us don't get a sufficient enough break from this to really create some distance from it. And many of us don't take steps to counterbalance the effects of the stress. This can be because we don't have the time to, we don't know how to, or for many of us, we don't even recognize we need to. I know for me, I'm a self person. And what I mean by a self person is I'm not going to ask anyone for help. I think I can handle most things. And when they get challenging, I'm just going to figure it out for myself and deal with it. But for many people, things can become overwhelming. I don't know how many inboxes you guys have, but I've got 2 phones, I've got multiple work and personal email accounts, and then there's Epic and my MHO messages and more. You add in social media, and we're well beyond most people's threshold of tolerance for input here. So in my observation, this is kind of the new normal. These responsibilities always coming at us are the modern version of what the saber-toothed tiger might have been to prehistoric man. So some of us are conscious of our anxiety and many of us are not. Obviously, some people have higher levels of anxiety to the point it runs their life. But at this point, we all have some degree of anxiety, which amounts to chronic stress. Even if only low grade, it's the chronicity of it that becomes problematic. And experiences don't even need to be negative. It's the totality of how much contact and busyness we interface with daily that becomes problematic. The body measures the intensity. So some of this can even be positive natured, but the sheer volume is enough to qualify as chronic low-grade stress. So here's why I think I have anything of value to say. Well, all day, every day, I see people before and after an acupuncture treatment. Relief from anxiety is one of the most common reasons people come to see me. I'm sort of a general practitioner in the sense I will treat anything and everything that I think Chinese medicine might be useful for. I mean, I certainly get people coming in for long-term work where we're trying to shift their physiology in the pursuit of shifting some internal medical disorder. And I have people coming in for an acute issue that's going to resolve in a handful of visits. Here's a common story. Someone comes in for an acute musculoskeletal problem that can be resolved in just a few visits. Soon later, they come back to report that while they were seeing me, they slept better, they felt less stressed, they got along with their spouse and coworkers better, they felt less irritable, and so on. Actually, if any of my patients are on this call, they might even think I'm telling their story, but this is a shared experience of many patients. And that's the cool thing about acupuncture. We are trying to restore balance and harmony in the body. So no matter what we are addressing, the outcome is you feel more centered. It's the first thing people notice when they get up from a treatment. Okay, so why do I want to talk about this now? Well, this is kind of a no-brainer, right? Given the events of 2020, many people are more aware of their anxiety. Even for those of you who do not identify as anxious, we are in contact with many people who are anxious. Coworkers and patients have reported anxiety about politics and COVID, about isolated relatives, stress around children at home, doing distance learning instead of going to school in person with their peers. We all have some degree of anxiety, and we all know someone who has even more anxiety than we do. And oftentimes we are so immersed in our own experience, we can lose perspective and not realize the level of agitation and tension living inside of us. Take me, for example. Most people think of me as calm, not anxious. I know I have some anxiety, but I think of it as mild and well-controlled. I know this because anxiety does not dictate my behavior. Rather, when I feel anxious, it's information that I become curious about, and I'm able to modulate it. I mean, of course, I can be prone to some situational anxiety from time to time, like ironically around giving this talk on anxiety. I enjoy my work, and despite being more of an introvert, I behave like an extrovert throughout my workday. Doing so feels sincere. It's part of my role here. Heck, they even pay me to be here. I had no idea how exhausted I was. My normal life is so busy. When I have a moment on a weekend, there is always an urgency. Do this now or it won't happen. So I recently took 2.5 weeks off work. I worked straight through all of 2020. I've never had this long of a stretch of time at home. And so suddenly, all of that urgency was removed. I went into my time off with an ambitious to-do list. And for the first 3 days, I did nothing. I wondered, is something wrong with me? I couldn't move. And after 3 days, I felt great. I resumed activity, and I had a big aha realization. How much of my energy was being sourced from momentum and anxiety. Momentum and anxiety. The pressure of chronically having more to do than time to do it is exactly what I'm talking about when I say many of us live with chronic low-grade stress. I was surprised I needed this experience to identify it. I think of myself as in tune with my body. But every day, I get to witness patients having this similar insights about themselves. Oftentimes, people will not realize they're stressed, but acupuncture can be so relaxing. It can really unwind the nervous system and be very soothing. When I come take out the needles at the end of a treatment, the patient has this new perspective from a place of deep relaxation, and they can see just how anxious or stressed they were. With the sudden absence of these feelings, they realize it was greater than they knew. So there are so many ways to address stress and anxiety. Acupuncture could be a useful tool. It quiets the mind, the body, and the spirit. And when stress persists for too long or comes on too suddenly or strongly, it imprints on the body and causes disharmony. Acupuncture can help reverse some of the negative effects on the body from stress and anxiety. For example, there are sets of points on the ear that have been well studied both formally and anecdotally for trauma, stress, and anxiety. Since they're on the ear, they can fit virtually into almost any treatment without interfering with other goals. I've played with this from time to time when it fit with distinct patient needs. Last year, I dubbed these points my 2020 points, and I did them on nearly every patient that came in my clinic. People reported feeling less stressed, more calm, sleeping better, less irritable, more tolerant, getting along with coworkers and spouses better, and so on. Often, a patient will come in with pain in multiple body areas. Sometimes their symptoms can be in more places than is convenient to treat in one session. If I evaluate that indeed there are structural problems and degenerative processes, then I have to treat each area separately. Oftentimes, this is not the case, though. People are just holding stress and tension in their bodies. In these cases, I found I can just focus the acupuncture on the stress and anxiety, using points to soothe the nervous system and calm the mind. When they get up, all of their pain has improved, as well as their mood. As so often, a patient gets up from a treatment and they turn their neck and turn their head from side to side and say, wow, those neck points really work great. And I'm thinking to myself, yeah, I didn't do any neck points. I just treated your stress. So Chinese medicine talks about this in terms of energy flow. When life's challenges are not too burdensome and things are going well, the energy flows smoothly. When things get difficult and we begin to feel frustrated, the energy begins to stagnate. There are nuances that vary per individual. Some of this is informed by which of the main emotions we get stuck in: anger, frustration, joy, sadness, grief, fear, anxiety, and so on. Notice I said joy. All emotions are normal. It's when they get out of balance that we get disease. Too much of a good thing can be too much. And each of the emotions can directly impact different energy pathways and organs. Yes, organs. In Chinese medicine, the organs house aspects of our consciousness. It's not just in the brain. From a modern science perspective, it is now known that every emotion and feeling has a neurochemistry to it. When we suppress or repress our emotions for too long, they become toxic to other parts of the body. I am told the latest research shows the first place this stuck chemistry damages is our immune system. Think about blowing up a balloon more and more. Eventually, it will burst. Similar is true with emotions. If we keep stuffing our emotions and feelings, it will increase our inflammation. Muscles have basically two actions. Muscles can contract or they can relax. Anxiety contracts muscles. The first muscles to contract are the striated muscles. These are the muscles that we have voluntary control over. Next, the smooth muscles contract. These are the muscles we do not have voluntary control over, like in our digestive system, in our pulmonary system, in our circulatory system. And so that can impact sleep also. Okay, I'm hoping this is making sense to you guys. I imagine people recognize this effect. For example, some people experience worsening neck pain and muscle tension when they're stressed and anxious. Others get stomach and digestive issues, gas, bloating, pain, diarrhea, constipation. I have many patients that know when they get too far off balance and they recognize it's time to come see me again, and often their loved ones thank them, noticing their short fuse goes away after. Okay, hope this has been interesting and useful to you guys. If you have further questions or you think it's a fit for you or you want to experience it, please call our clinics and come try out some acupuncture. Thanks so much for joining today.